There is something sitting in most people's kitchen right now that has been studied in clinical exercise physiology for decades. It is cheap, it is familiar, and most people have absolutely no idea it has anything to do with blood flow, circulation, or physical performance. It is baking soda, sodium bicarbonate, the same compound in your baking cupboard. Now, before you assume this is one of those clickbait health videos making wild claims about a kitchen ingredient, let me be clear. The mechanism here is real, well documented in exercise physiology research, and worth understanding. I am going to explain the actual biochemistry, how your blood's pH balance directly affects blood vessel responsiveness and oxygen delivery, why this gets meaningfully worse after 60, and what the research shows about sodium bicarbonate's role. I am also going to explain who should absolutely not use this, because the contraindication list for this compound is longer than most wellness videos acknowledge. And as a urologist, I have a specific perspective on the kidney angle that no other video on this topic covers. My name is Dr. Elizabeth Kavaler. I am a board-certified urologist and urogynecologist with over 20 years in clinical practice. Acid-base balance, kidney function, and their downstream effects on circulation and physical performance are topics I work with clinically every week. What I share today is grounded in published research from the Journal of the International Society of Sports Nutrition, the British Journal of Sports Medicine, and the clinical guidelines of the American Kidney Foundation. Let me explain the biology, because it is genuinely interesting and it connects directly to why so many men over 60 hit a wall during physical activity that they did not used to hit. When you exercise, your muscles burn glucose and fatty acids for energy. One byproduct of this process, particularly during moderate to vigorous intensity effort, is hydrogen ions. Hydrogen ions are acidic. As they accumulate in muscle tissue and the bloodstream, blood pH drops. The blood becomes more acidic. This process is often loosely called lactic acid buildup, though the mechanism is more nuanced than that. Here is why it matters for blood flow specifically. The endothelial cells that line blood vessels, the same cells that produce nitric oxide for vasodilation, are sensitive to pH. When pH drops, endothelial function is impaired. Blood vessels become less responsive to dilation signals. Oxygen delivery to tissues decreases. Fatigue accelerates. You hit the wall. Your body's natural defense against this is the bicarbonate buffering system. Bicarbonate ions in the blood neutralize hydrogen ions, moderating the pH drop and extending the window before fatigue sets in. Think of bicarbonate as your blood's natural acid absorber. Here is the age-related problem. After 60, two things change. First, resting bicarbonate levels tend to be slightly lower due to age-related changes in kidney bicarbonate regulation. Second, the respiratory compensation that helps manage acid buildup, breathing faster and deeper to expel carbon dioxide, is less efficient in older adults due to reduced lung elasticity and respiratory muscle strength. The combined effect is that the buffering window shrinks. Fatigue comes earlier, recovery is slower, and circulation during activity is less responsive. Sodium bicarbonate as an ergogenic, performance-enhancing supplement has been studied since the 1930s. The modern evidence base is solid for specific, well-defined applications. A meta-analysis published in the British Journal of Sports Medicine in 2021 examined 87 studies on sodium bicarbonate supplementation and physical performance. It found a consistent, statistically significant improvement in performance during high-intensity exercise, lasting between 60 seconds and 10 minutes, the exact duration range where hydrogen ion accumulation most constrains performance. Effect sizes were moderate but clinically meaningful, roughly a 1 to 2% improvement in sustained performance, which translates to noticeably less fatigue and better recovery. For older adults specifically, a study published in Medicine and Science in Sports and Exercise found that sodium bicarbonate supplementation improved exercise tolerance and reduced perceived effort during submaximal cycling in adults over 60 compared to placebo. The mechanism was exactly as described: improved buffering capacity during effort. What this does not do: it does not replace cardiovascular fitness. It does not treat arterial disease. It does not improve resting blood flow in sedentary individuals who are not exercising. The benefit is specifically during and immediately after physical exertion, supporting the buffering system that allows your blood vessels and muscles to work more efficiently under physical load. If you are asking whether dissolving baking soda in water and sitting on the couch improves your circulation, it does not. If you are asking whether it can help a man over 60 push a little harder during a walk, a swim, or any sustained physical activity without hitting the fatigue wall as early, the answer is yes, with appropriate caution. If you want to try this for exercise performance, here is the protocol that appears in the research literature. The dose used in most clinical trials is 0.2 to 0.3 grams of sodium bicarbonate per kilogram of body weight. For an 80-kilogram man, that is 16 to 24 grams, roughly 1 to 1.5 teaspoons of baking soda. For a 70-kilogram man, 14 to 21 grams, approximately 1 level teaspoon. Timing matters significantly. The peak buffering effect occurs approximately 60 to 90 minutes after consumption. Take it 60 to 90 minutes before the exercise you are planning, not immediately before. This gives your body time to absorb and distribute the bicarbonate into the bloodstream. The most important practical tip for reducing the gastrointestinal side effects, which are the main reason people abandon this protocol, is the fizz-and-wait technique. Dissolve the baking soda in 500 milliliters of water. Let it fully fizz and settle before drinking. The carbon dioxide produced during this reaction is part of what causes bloating and nausea if consumed while still actively fizzing. Drinking it after the fizzing has stopped significantly reduces GI discomfort. Sip it slowly rather than drinking it in one go. Use this only on exercise days, not daily. There is no benefit to daily supplementation outside of exercise context, and the sodium load of daily use over time has its own risks for blood pressure in susceptible individuals. As a urologist, I want to add something that no other video on this topic covers, because it matters clinically and it is directly within my specialty. Sodium bicarbonate is excreted by the kidneys. When you consume it, your kidneys process the bicarbonate load and excrete the excess in urine, alkalinizing urine pH in the process. This has two specific implications for urological health. First, for kidney stone prevention. Uric acid kidney stones, one of the most common stone types in men over 50, particularly men with gout or high-protein diets, form in acidic urine. Alkalinizing urine with bicarbonate is actually a well-established clinical strategy for reducing uric acid stone formation. Potassium citrate and sodium bicarbonate are both used clinically to raise urine pH above 6 in patients with recurrent uric acid stones. If you are a uric acid stone former, the occasional sodium bicarbonate protocol for exercise may carry an additional urology benefit. The flip side, calcium phosphate stones, which are less common but do occur, form in alkaline urine. If you have a history of calcium phosphate stones specifically, adding sodium bicarbonate to your routine without clinical guidance could increase stone risk. This is a nuanced point that requires knowing your stone type, something to discuss with your urologist. Second, for kidney function. If you have chronic kidney disease, the kidney's ability to regulate acid-base balance is already compromised. Adding a bicarbonate load to a system that cannot properly process it can cause metabolic alkalosis, a dangerous shift in blood pH in the alkaline direction. Chronic kidney disease is an absolute contraindication for self-administered sodium bicarbonate supplementation. Let me be direct about the contraindications, because this compound is not appropriate for everyone. Do not use sodium bicarbonate supplementation if you have chronic kidney disease at any stage. The kidney cannot safely process the bicarbonate load. Do not use it if you have heart failure or any condition where sodium retention causes problems. Baking soda contains significant sodium, approximately 1,000 milligrams per teaspoon, and that sodium load matters. Do not use it if you are on a sodium-restricted diet for any medical reason. Do not use it if you take medications that are sensitive to blood pH changes. Certain chemotherapy drugs, lithium, and some diuretics have altered activity at different pH levels. And if you have a history of kidney stones, know your stone type before experimenting with anything that alkalinizes urine. For men with well-controlled blood pressure and no kidney disease who want to try this specifically to support exercise tolerance, one dose before a planned walk, swim, or exercise session, the risk profile is low and the potential benefit is real. But start with the lower end of the dose range and stop immediately if you experience significant nausea, muscle cramping, or any concerning symptoms. Baking soda for blood flow and exercise performance is not a viral wellness trend. It is a well-studied compound with a clear, documented mechanism and a legitimate evidence base in exercise physiology, one that has been in the clinical literature for nearly a century. It works by supporting the bicarbonate buffering system that keeps your blood pH stable during physical effort. After 60, that buffering system is less efficient than it used to be. Supplementing it strategically before exercise with the correct dose and timing is a science-backed approach that most men have never heard of. Use it thoughtfully. Know whether it is appropriate for your specific health situation, and combine it with the physical activity it is designed to support, because baking soda sitting in a glass on the kitchen counter does nothing without the effort that makes buffering matter. I am Dr. Elizabeth Kavaler. I will see you in the next video.